this periosteum, just to close. Remember this historical GTR, GBR technique. So this is represented by this case, extraction of the second premolar, just after the extraction. In this case, personally, I want to get rid of this granulation tissue, because we know that in some cases of infection, we have granulation tissue. So I'm using different types of lasers. Actually, I have 28 different lasers, but in this case, I'm using 2 different types of lasers. The first one will make the full vaporization of this, you all know this, lamina dura, the cribulating plate, the plate that is hosting all these Sharpei fibers. Because again, if this socket, after extraction, has a high degree of contamination, even if you make a debridement manually, slowly, precisely, you're not able to take out every granulation tissue. You're not able to even take out these lamina dura. Some tools can do that for you. Of course, your hand and taking a curette, and what happened? Very often in premolar sites, first or second premolar, you take in the curette and too strong, and then the Lucas curette is appearing outside, making a bump. I have some cases like this. With the use of some tools, like the laser, the vaporization is so superficial that you will not apply any force on your thin cortical plates. Then I'm using here a second wavelength, a diode, that will allow me to make a full decontamination of the tissues, both hard and soft tissue, within the depth. And then the placement of the implant. Actually, here as well. I did this myself again, sorry about the design. It's not well done, but it's fully explicated. We will have the primary stability within few millimeters, but here, very often we have a gap. But, and because we make the full vaporization of these potentially contaminated tissues, and then at the same moment that we are able to close the soft tissue with a special management of your periosteum, then what it is? A GBR technique. But the GBR technique without the use of membrane and without the use of biomaterial. No bone substitutes. Just closing. And for those that are interested, just don't leave. Just at the end, I will show you what you can gain with the growing potential, regrowth potential of the soft tissue within the surgery of some surgical aspect of the scars. Scar revision. Anyway, in this case, and because the gap was too wide, so I had to, with my curette, just lifting up the periosteum, then closing and trying to close as much as possible with here the use of 2 stitches and closing around my healing screw, healing cap. But remember that the placement of the implant is deep inside. So this is after 2 months, and this is the healing view. And what are these famous 4 major principles of the GBR technique? Is the primary closure of your wound, because what is the substantial meaning of this GBR technique? Is placing a membrane that will avoid the competition of the cells between the osteoblast and the cells coming from the epithelium lineus. Then we want to enhance the angiogenesis. Without blood supply, no regrowth, whatever, soft or hard tissue. Then personally I'm using some tricks, like doing some osteotomy pits with the use of some lasers that allow me to make this socket bleeding. We need a space creation. We need to create this space and to maintain it. But at the same moment, we need to stabilize this space. We know that this stabilization will promote the growth of a clot. And this clot, if it's differentiated from the cells coming from the epithelium lineus, then they will transform in bone, vital bone. So different aspect with the use of an erbium laser and then the use of iodine to make the full decontamination. Then another animation to show how you get this vaporization. And I just want, because I know that some of you, because I talked to some of you before, and some of you are working with any lasers, but I just want to show you, this is the peri-implantitis treatment. Nothing to do with placement of implant, but treatment of implant pathology. This was the implant. A flap is done, is raised, and you see the erbium laser. And just look at this buccal plate here. Very thin. You want to stop? You want to make a break? 10 minutes. 15 minutes. Okay. Just give me a sign. But look at this. We can vaporize this granulation tissue. Why I put this video? Because this is actually what we're getting in making the debridement of the socket. But look at that. The laser is so selective that it will vaporize your granulation tissue, but it leaves the buccal plate here. You see how thin it is? Very thin. But this is one property, one of those numerous properties of the laser. The laser is selective. There's a selectivity in tissue. So just to let you think of what you can do. Like I was saying, bone spreading and bone expansion and under preparation of the bone bed implants. Summers was the first one. Why? Because Summers showed that it's not the right slide anyway. I put this slide because I wanted to show you, with the use of a laser, an erbium laser, what you can do. And using a laser is part of the procedure, but which is very important here is this was actually a study that have been published in Journal of Advanced Prosthodontic in 2010 by a South Korean group. And these guys, and this actually what my friend called like the BS, nursery called the BS, we have a lot of BS in terms of publication. That means that actually he said that more than 80% of the publication have BS. That means that doesn't remain a lot. Anyway, the topic is not there about talking about BS, but you know that there's different BS. But anyway,